BBC News top story. Hoped over trial malaria vaccine test. Final clinical trials of a malaria vaccine, the first to reach this stage, suggest it could help protect millions of children against malaria. But tests on 16,000 children from 7 African countries found that booster doses were of limited use and vaccines in young babies are not effective. After children aged 5 to 17 months were given 3 doses of the vaccines, the immunization was only 46% effective. But experts say getting the vaccines this far is a scientific milestone. Data from the trial published in the Lancet showed that the success rate fell to even lower levels in younger infants. Scientists have been working on the vaccines for more than 20 years, but observers believe there is still a long way to go. RTS S01 is the first malaria vaccine to reach advanced trials and shows any signs of working in young children. There is currently no licensed vaccines against malaria anywhere in the world, with around 13,000 children dying in sub-Saharan Africa from malaria every day. Scientists say they are delighted to have got to this stage in developing a vaccine against a very clever parasite. Professors Britton Greenwood, study author and professor of clinical tropical medicine at the London School of Hygiene and Tropical Medicine, said he was a little disappointed by the results of the clinical trials. I hoped the vaccines would be more effective, but we were never going to end up with the success since in measles vaccines with 97% efficacy. That is because the malaria parasite has a complicated life cycle, and it has learned how to evade the immune systems over hundreds of years. The vaccinations took place at 11 sites across Burkina Faso, Gabon, Ghana, Kenya, Malawi, Mozambique, and Tanzania. The trials found the vaccine's ability to protect children gradually waned over time. Scientists tried to bolster this with booster, but protections never reached the level provided by initial dose. The clinical trials also found that meningitis occurred more frequently in children given the vaccines. However, Professor Greenwood said the data was very robust, and the vaccines could still reduce attacks of malaria by around 30%. The European Medicines Agency will now review the data, and if it is satisfied, the vaccines could be licensed, and the World Health Organization could then recommend its use in October this year. Professor Andrew Hill at the University of Oxford says although the study was a milestone, he has concerns. Because the vaccine's efficacy is so short-lived, as expected, a booster dose is shown to be of some value, but it was not as effective as the initial dose. More worrying is the new evidence of a rebound in malaria's susceptibilities after 20 months. Vaccinated children who were not boosted showed as an increased risk of severe malaria over the next 27 months compared to non-vaccinated controls. Overall, he says the vaccine's potential public health benefits were not yet clear. It should be possible to make the vaccines more effective in some settings, but that will probably increase delivery costs substantially. Professor Mike Turner, head of investment at the Wellcome Trust, said it has taken 2 decades to get to this point. While the level of protection the vaccines offer against clinical malaria may seem relatively low, They are better than any other potential vaccines we currently have. The findings are not only important in their own right but also in signposting a road to developing better vaccines in the future. James Whitting, from the Charity Malaria No More UK, said it was a huge achievement to get the vaccines this far. There are still a number of considerations and approval process to be undertaken, but it has the potential to be an important additional tool to fight malaria and save lives from a disease that kills a child every minute. Other experts warned that funding for a vaccine should not be redirected away from insect nests and other malaria control measures. This is the end of this top story. Thank you for listening. Goodbye.